And welcome back to another episode of OSCE Talk. Today we're going to be going through a model chest pain history, and myself and Peter are just going to be giving some tips on, important questions to ask, how to present at the end of a history, especially in chest pain, and then also just doing a little bit of teaching on, differentials of chest pain, what investigations you might ask for at the end, and, important things to highlight in the history. So the first thing I want to talk about quickly is just some of the symptoms that we're going to be running through, and I really have a core list of probably about 6 to 7 symptoms that I want to do in the history presenting complaint. Often they will come out with the chest pain, or they might present with another symptom. Common other symptoms might be, I'm very short of breath, I've got my chest, my heart's racing in my chest, or, I'm finding it quite hard to walk because there's pains in the backs of my legs. They might say things like, I'm feeling dizzy, I'm feeling faint. There's a number of sort of slightly vaguer ones. I would say certainly at a first and second year level, it's going to be quite simple, and it will be, chest pain or shortness of breath to start off with. So just make sure that you cover, that range of symptoms.
Yeah, brilliant, Matthew. So, okay, guys, now we're just going to move in to an example of history. It's just going to be some of the points we've talked about in the last episode, and you're just going to really see that in action now.
Perfect. Okay, so hello, my name is Matthew Pettigrew. I'm one of the resident doctors here today. Do you mind if I just check your name and age, please?
Hi, my name is Mr. Johnson. I'm a 68-year-old man.
Nice to meet you, Mr. Johnson. Is it okay today if I just ask you a few questions about why you've come in and how you're feeling? Is that okay?
Yeah, absolutely.
Okay, so why have you come in today, Mr. Johnson?
I've got a really bad pain in my chest.
Okay, and can you tell me a bit more about that pain?
It's just really sore.
Okay, and can you point exactly where the pain is in the chest?
Just right here in the centre.
Okay. And when did that start, Mr. Johnson?
Started about an hour ago.
Okay, and any words to describe the pain that's actually in the chest?
Heavy. Just feels really heavy.
It's really, really tight and heavy.
Mm-hmm.
Okay. And does that pain move anywhere, Mr. Johnson?
It's moving a bit up into this shoulder and a wee bit into my jaw.
A bit into the jaw as well. Okay. And how long's that all been going on for?
About an hour now.
About an hour now. Okay. And have you noticed anything that has brought that on over the last hour?
No, well, I was out for a walk at the time, and I was walking, and then I stopped, and it just hasn't settled.
Okay. And can you think of anything that would have triggered it? Was it the walking, do you think?
I think it might have been, yeah.
Okay. And have you noticed anything that's made it any better at all?
No, I've had some pains like this before, and whenever I rest, it gets better, but it's not getting better this time.
Taking any medications or anything at the moment, Mr. Johnson?
I haven't taken anything, no.
And Mr. Johnson, if you had to rate this pain in your chest, 10 being the worst pain you've ever felt, what would it be at the moment?
I'd say it's an 8.
An 8. Okay, that's really significant, Mr. Johnson. I'd want to think about pain relief and things for you at this point before we continue. And Mr. Johnson, you've mentioned you've had pain before. Can you tell me a bit more about that?
Yeah, I've just over the last few monmonths, I've just been starting to get a bit of this heaviness when I'm out walking the dog usually, but it normally settles, but this time it's just not settling.
Okay. And you've never had pain exactly like this before then?
No, not for this long, and not this painful.
Not this painful. Okay. And can I ask, are you having difficulties breathing at the moment?
Yeah, I feel a bit short of breath.
Bringing anything up or coughing anything?
No.
Have you ever had issues, with shortness of breath at home, walking up the stairs, things like that?
Never.
No. Do you get short of breath when you're lying flat in bed or anything?
Never, no.
Or would you ever wake up short of breath in the night?
No.
Any sort of pains down in the ankles ever in the past, Mr. Johnson?
No, I've never had anything.
No. Not while you're walking or anything?
No.
No. Have you ever noticed that your ankles are swollen at all?
No.
No. Have you ever had the sensation that, your heart's beating very quickly?
No, I've never had that.
Or have you ever sort of had a faint, a fit, or a funny turn, or went unconscious?
No.
And at the minute, Mr. Johnson, you mentioned that you feel quite sick and quite nauseous. Have you vomited so far with it?
No, I don't, but I feel like I could.
Feel like you could. Okay. Look, I'm really, really sorry to hear that. We'll try and get you some medications and make you feel a bit less sick. Okay. Do you have any conditions you're living with at the moment, Mr. Johnson?
I think I've had high blood pressure and I think high cholesterol.
Okay. And how long have you had those for?
Oh, I've had them a long time. I've been on medications now for a few years.
Okay. And what kind of medications? Would you know the name of any of them?
A statin is one of them. I can't remember the name of the blood pressure.
Okay. No, absolutely. Look, no problem. We'll take a look at those. Have you taken anything today, Mr. Johnson?
No, I haven't taken any medication today, no.
Any allergies to anything or anything you can't take?
No allergies, no.
And does anything run the family, Mr. Johnson?
I don't think so.
Anyone in the family had a history of heart attack specifically?
Well, my mum had a heart attack.
Okay. And can I ask what age she was when that happened?
She was 70.
Okay. I'm sorry to hear that. Did she have to go to hospital with that?
She passed away. It was quite a big heart attack.
Really, really sorry to hear that, Mr. Johnson. Look, we're taking this very seriously today, and I probably want to do a few more tests. Just I'm quite worried about how sore your chest is at the minute and how unwell you're feeling. That is worrying me a bit. Okay.
Thank you.
Just thinking then about your home life. Is it just yourself at home, or is there anyone else?
It's just me at home. Yeah.
Do you smoke at all at the moment, Mr. Johnson?
I do smoke.
You do. And how many a day would
About
that be?
30 a day since I was 16.
And can I ask, is that cigarettes?
Yes.
And any other sort of alcohol, anything else that you would take at home?
I take about a bottle of wine every day.
Mr. Johnson, just what would your diet be like?
It's not great. I eat a lot of takeaways, things, should be better.
Look, thanks for telling me all that so far. Just before we continue, do you have any ideas, concerns, or expectations from today?
I'm just really concerned that it's a problem with my heart. I don't normally come to see the doctor, but I'm quite worried about it.
Absolutely. And look, I'm taking this really seriously, and I want to figure out what's going on with the heart, and hopefully we can find some answers to that. Mr. Johnson, quickly, I'm just going to summarize what you've told me today, and then I'm going to chat to the examiner, if that's okay. So yes, just to summarize today what we've talked about, Mr. Johnson is a 68-year-old man who's presented with a 1-hour history of sudden onset crushing chest pain, which started in the centre of the chest but is also now moving to the neck and the jaw. He's had a history of pains like this over the last number of months, normally brought on by exercise and then relieved just by resting. But in this today it hasn't settled. He has a significant past medical history of high blood pressure and high cholesterol, which he takes medications for. He hasn't taken any other medications today, and he's no known allergies. His his family history is significant. Unfortunately, his mum did pass away of a heart attack in her 70s. In terms of his home life, Mr. Johnson smokes and also drinks alcohol.
Thought that was a really good history, Matthew. So we're going to move in now to just asking some questions for some learning. So in this kind of patient, what investigations would you be thinking about doing?
Yeah, absolutely. If you saw this person in GP, I think the first thing you'd think is maybe GP isn't the most appropriate setting to see them in. But in GP, you would very quickly get an ECG of their chest. You want to see if there's any ECG changes present, and that'll tell you whether, it's more of an ischemic event, or whether, there's actually death of the tissue in the heart. Other things that then they will do as you sort of come into A&E would be then blood tests. And I think really importantly for this, the blood test is going to be the troponin level. In a patient like this, they'll get their troponin level taken sort of immediately on attendance to A&E, and then that will be compared with usually a blood troponin after an hour or after 3 hours, and that's just to see if there's sort of a big spike. You have to think then, what else could be causing chest pains, and I think a whole host of other things. So we need to think, is there infection present? So in terms of the bloods, we'll take a full blood count, look at the white cells. We might also then check, kidney function. And the important thing about that is that we're going to be then possibly treating this heart attack with a number of medications that will impact on the kidneys. So we need to see whether there's any decline on kidney function. Other good ones would be things like ESR or CRP. They're more non-specific, but they will be raised. You could also consider a test such as a D-dimer, although this will be commonly raised in patients with any form of inflammatory or infective response.
Absolutely. So my next question then for this patient, if I was an examiner, might be, can you give me some differential diagnosis?
Yeah, absolutely. And I think the important thing is to then order the differentials at the top. So I'm going to say, I'm really worried this patient is having a heart attack or a myocardial infarction. Other things that I could be worried about is an unstable angina type event. I might also then be worried about less common causes of quite significant chest pain. That could be things like an aortic dissection, or even less common things that wouldn't be sort of exactly at the top of my mind could be something such as a pulmonary embolism, or even a pneumonia or pneumothorax. And again, those are sort of more respiratory causes of chest pain.
Yeah, another question that I have, because consultant cardiologists often like to ask this one, is what's the difference between modifiable and non-modifiable risk factors?
Yeah, absolutely. So there are risk factors that we can change. So those are our modifiable risk factors, and there are unmodifiable risk factors, and those things, unfortunately, we can't change. So in this patient, I'll pick up on some of the modifiable risk factors. Those will be things like the fact he is smoking quite a significant amount. He's drinking quite a lot of alcohol, and, he's got a history of high cholesterol. So those are all things that we can fix, stop him smoking, reduce the alcohol intake and get him on statins and blood pressure tablets. So those are modifiable. Unfortunately, he has a number of non-modifiable risk factors, and that's what's sort of flagging up the red flag of heart attack in this patient, because I'd be worried about the fact he's a man and he's over 50.
Okay, guys, thanks for listening. This has been our episode on chest pain. That was quite a deep dive into it. We're not necessarily going to go in depth as that every time, but as this is the first time going through a history, when we wanted to give you a good example of how to take a good history and just go through some of the points. Next episode, we're going to just show you a different type of cardiac history, and we're going to focus more on heart failure, and then Matthew's going to do some really good teaching on that as well, guys. So make sure to come back for the next episode.